This case, of course, has stunned so many people who are now asking, how in the world could something like this happen, and how can we make sure something like this never happens again?
Joining us now is Christopher Fries, an associate professor at the University of Michigan School of Nursing. So, Professor, thanks for joining us. Tell us, how did this happen in the first place?
Well, the first thing to know is that Dr. Fata is not the first criminal who has preyed on cancer patients, and he's not going to be the last. I think how this really happened was a fragmented care delivery system. Doctors are reimbursed by the number of drugs they give, not how well they care for a patient over the course of the illness. And the oversight of these clinics where a lot of the chemo is given is not regulated like a hospital or another facility. So it's very easy for this kind of thing to have happened.
Is this all about pure greed? I'm still stunned that a doctor would knowingly do this to somebody. Did perhaps he start off just making mistakes? And I mean, how did this happen? What was he up to?
Yeah, I mean, I'm not a psychological expert. I think that's worth looking at, but I think primarily when I see this, it appears to be greed. He drove up prices of the drugs he would give to patients. He made sure he got the most reimbursement, millions and millions of dollars. So to me, it speaks of greed, but if there's another motive, we haven't heard it in the news reports.
We know that there is a lot of Medicare fraud that goes on and a lot of fraud in the health system. The feds are constantly working on that. How do we stop it?
Well, I think the first thing we do is we have better oversight. And so now it takes us years to analyze these data, the data that we know about Dr. Fata's claims. Hopefully over time we can speed that process up. But the other thing that's curious here is this was happening for years in Dr. Fata's clinic, and a nurse actually identified the problem in 2010, and her concerns were not acted upon. Now, the state has strengthened the way that they regulate medical providers so that if there's a complaint, it's easier to move forward. So I think that's one important step. But the other thing is patients and families, if they think something's wrong, just like your previous guest said, they shouldn't be afraid to speak up. They should definitely seek a second opinion, and they shouldn't be afraid to take their concerns to the state.
Now, Christopher, you wrote a guest column in the Free Press, and I want to quote from that because it's very salient here. Until the public becomes informed and outraged enough to demand improvements in oversight, you said, I fear the necessary changes won't happen rapidly enough to protect patients from the next Dr. Fata. Do you really think that this is going to happen again?
Well, it already has. So June of 2015, a doctor in Florida was indicted on very similar charges, buying drugs from Canada and England that's not approved by the FDA and billing Medicare for those full prices. So we have a lot of work to do. The problem here is there's a mismatch of the federal government, a private insurer, so it's going to take a little bit more work. But the other thing we don't have is a clear reporting system of when these things happen. We have ways to know when a restaurant has health citations. We know from Yelp and Open Table what our restaurants look like, but we don't even know how patients fare after their chemo treatments. So a lot of us are really asking for uniform reporting of quality of care measures in cancer setting. We give a lot of chemo. We give tons and tons of doses, but we have no idea how patients do after they're treated.
Well, you've studied oncology clinics around the country and in Michigan. What have you found?
So we did some analysis just specifically of Michigan practices. We did a survey last year, and we found that a lot of nurses had concerns about the quality of care in their practices. Some nurses reported doctors were not on site when we gave chemotherapy. Some nurses said they didn't have defibrillators. And we have a defibrillator on every airplane in this country, but we don't have them in clinics where we give toxic chemotherapy. So these are some action steps we can take to make sure that clinics are following recommended guidelines.
All right, Christopher Fries, Associate Professor at the University of Michigan School of Nursing. We do thank you for your time and your expertise and advice on this.
Thank you.
And still ahead.